At the height of the pandemic, when everything else paused, one company leaned in. Talkiatry launched in April of 2020 with a mission to bring high-quality psychiatric care to people who need it most and fast. Here's how Dr. Georgia Gaveras, a triple board-certified psychiatrist and co-founder of Psychiatry, describes what it was like to build a mental health company from the ground up during one of the most uncertain times in modern history.
And then we thought, it could be a couple of weeks. We'll be back in office in a couple of weeks. Everyone kind of thought that. And then very quickly, we realized that wasn't going to happen. We were hoarding toilet paper and watching Tiger King. Remember that phase of the pandemic? So we decided that it wasn't going to end. And we were actually getting calls from people to schedule appointments from all over the country. But we're based in New York. But we thought, well, people will come to the office. So, you're calling from Arizona or you're calling from Rochester, New York or something. You're not going to be able to come to the office when this whole thing is over. So, we can't really accommodate you. And then we realized, well, this isn't ending. And telehealth, which existed well before the pandemic, it wasn't created with is going to be a major part of our lives.
But to scale access in a meaningful way, it wasn't just about seeing patients through a screen. The technology itself had to support privacy, trust, and an experience that felt just as real as sitting across from someone in a room.
It's not as simple as just calling your doctor, FaceTime or something but there's so many considerations about privacy, about security, all these things that go into, you don't have to think about when someone's coming to your office, but when you're doing it over a televisit, it is important.
Because when someone takes that first brave step toward mental health care, everything matters. The access, the environment, the connection. And sometimes the ones who need our empathy the most are already living inside our homes. Today's conversation, we also talk about Netflix's most recent series, Adolescence, and how misunderstood childhood anger can be, and that it actually might be a cry for connection. If you're raising kids, leading teams, or just trying to keep it together, considering the emotional whiplash of the world, this episode is for you. Let's get into it. One of the toughest balancing acts we hear from our listeners, especially women building businesses or leading teams, is really managing what's happening in our own homes with our own children and aging parents, and while trying to change the world outside of all of it. But recently, I just watched Netflix Adolescence, and it's raw and messy and a very honest portrayal of teenage mental health and the not so subtle pressures of social media and perfectionism and so much more. And I've been processing so many thoughts about it. And so the timing of having you on today is so perfect because while it's powerful that these stories are being told, I really am so curious to know what's the real story that's not being shared, what's happening in therapy rooms and in family conversations and the moments we don't see on screen. So our guest today is Dr. Georgia Gaveras, and she is the Chief Medical Officer and co-founder of Psychiatry, one of the largest in-network psychiatric care providers in the United States. But she's also triple board certified and has spent over 2 decades specializing in child and adolescent psychiatry. She's been on the inside of this conversation for years, long before streaming has made it bingeable. Welcome to Redefine Her, Georgia.
Thank you so much. Thank you for having me, Brenda. Appreciate it.
Yes, most definitely. So as women leading teams, growing companies, and raising families, we're all trying to just keep up with the crazy pace of the world and where our children are growing up. But what has been your take on Adolescence? It's obviously Netflix's latest hit. It is alarming, disturbing, all the things, certainly more than entertainment, hopefully a wake-up call. But tell me, what are your thoughts on it?
So I had read good things about it. I was really excited to watch it. And one of my best friends, who's also a child psychiatrist, texted me. She's like, this is really hard to watch. And I'm thinking, okay, if it's hard to watch for her, I'm a little wary. I actually watched it on an airplane. Yeah. So it was a lot. First of all, it's an incredibly well-made series. I think it's just on, as a show, I think it's incredibly well made. And I thought about it. I was like, well, why did I care so much about how it was made? I'm not a filmmaker, but the reason I liked it is because it was essentially in real time, and you really got to sit and feel along with the people that you were experiencing. And I love that you got to sit and feel these things with people that are involved in so many different ways. The law enforcement, obviously the child himself, the therapist, the person who does his evaluation, and his parents, and his sister, actually, really importantly, I think his sister, and of course his peers. So that's why I think I loved the way that it was made. It is an incredibly difficult watch, and I guess we should say spoiler alerts because we're going to talk about what happens during the show. But I think that in the end, it shows that there's no villain. I mean, it's really easy if you just hear, a kid killed another kid. Then there's a perpetrator and a victim. It's really easy to just say, well, he killed somebody. He should have done that. And the poor girl died. And as you watch it, you just realize everyone's a victim. Everyone is involved in this. And it's heartbreaking because everyone actually is trying really, really hard. I think that's why my friend was like, this is going to be hard to watch because we'd like to think that we could have done something different. We like to think that there was that moment like, oh, just that, but there isn't one. And I think that it shows us that all these things that happen to kids and that experience and kids do are really a accumulation of just everything around them in their lives, from their peers all the way through experiences, online, offline. It's really important. I think if somebody has the stomach to watch it and sit with that, I think it's a really important watch for everyone. Yeah.
It's brought up so many conversations, and I have a almost 16-year-old, and so
You live it.
totally. But
Yeah.
some of the conversations, they show up a lot with their own ego, like we all can and do. And then like he cuddles in and he's like still this baby, but ultimately, as you're saying, like we're all victims and we're all accountable. And it's trial and error. It's this grand experiment of life. And this show really portrays so many different topics that we really should be having conversations around. Which, to you, what's something that gets overlooked in portrayals of adolescent mental health on screen that's absolutely vital in the real clinical world?
It's a misconception of anger in kids. You see a lot of angry kids during this show. And obviously the actual event is an act of rage for the child that kills the other child. And then you see it in his friends. You see it in the girl's friends. A really interesting part of the cast. And I think they didn't actually spend enough time on the victim, the girl that was murdered. There was a really interesting backstory that was alluded to when she was sitting with a counselor or a teacher, whoever that adult was, that implied there was definitely something in the home, something possibly abusive, neglectful, something, some emotional abuse, something. And just her utter helplessness. The last time we see her, she just looks helpless and alone and so angry. And we focus too much on their behavior. You hear this all the time, like, stop acting like this. But we're not asking them, why are you acting like this? Prior to starting Talkiatry, I was a director of a psychiatric emergency room, and I'm also a child psychiatrist. So we'd see kids brought in because they had an outburst of some sort. They fought, they broke something, they fought, they threatened something. And so many times I hear that they're in therapy for their anger management. And I tell people, anger is a normal emotion. Like, it's an emotion we all have. And it's not a bad emotion, because anger is what can lead to change. If you're angry about something that's unfair, then you can lead to change. It's what you do with the anger and how you express it. That's what could possibly be problematic. And in kids, not enough times are we asking, well, why are you angry? People don't realize that anger is actually a core symptom of depression in kids. And a lot of times it's a very primitive emotion. A lot of times it's expressed as anger, but when you really talk to somebody, there's so much depression and anxiety and things that we just don't ask kids about. And I think subliminally we don't ask kids about it because we don't want them to be sad and we don't want them to be anxious. It's much easier to say, could you just stop that, than to have them say, I'm anxious because of fill in the blank, or I'm depressed, or something like that.
And something I have to look at it myself. My girlfriend, and she's a data scientist, but she says anger is sadness coupled with blame.
Yeah, I think that's great. I think that's great.
And a lot of this, we could point our finger and say social media is quite regrettable right now, but it's hard to control. What do you think is the most urgent unspoken challenge facing adolescents, and why aren't we talking about it enough? Obviously, anger as a piece of it and emotional regulation, that's a challenge for children in any case. They're developing, and it's part of our job to help them with that. But we're not always equipped to deal with it. It's power in the pause, but we're not great at that ourselves.
Of course not. I mean, we try, and eventually your brain develops where you're better at it. Social media doesn't always help the situation. I'm not going to say it always hurts the situation, but it certainly doesn't always help it. It also just gives kids so much access to the things that are upsetting to them. And because it's been kind of ingrained in our culture, this is just part of our culture. It's something you have to have. That kids are like, well, I have to have it, so it's making me upset, but I can't get rid of it because what am I going to do? It's a necessary part of life.
Right. It's their social construct.
It's their social construct. It's interesting. Ever since social media has proliferated, we become lonelier. So that's counterintuitive, isn't it? So it's one of those things where I can see the people that are advocates for it. I can see where they're coming from, but the implementation is where the problem has come, especially when it comes to kids. And I'm not putting the blame on parents. This is just one part of it. It's just parent is a verb. It's not just a noun. So you have to know what your kids are doing online. Now, I come from a generation that obviously far removed from this. When I was a kid, I didn't have a cell phone until I was in med school. So it's a completely different beast. But if there was bullying, you went home, the bullying stopped unless the kid came to your house. So it was a very different, you can get away from it, and your parents were more aware of it, I think, because you were in front of them more. But now not only are kids on social media, but parents are too. I'm in New York City and I ride the subways and I see kids on their phones, and next to them, the parents are on theirs. I mean, no conversation is going on. So it's also taken us away from these moments where we try to be present with our families and with our kids to have these conversations. It's taken us away from those moments as well. And I think it's something everyone should just take a look at, balancing social media's role in their lives with actual face-to-face conversations with their kids or their loved ones, whomever, and try to balance that and really understand that they're both very, very important. I would argue the real life conversation with your kid is a lot more important than whatever's on Instagram. I don't have Instagram, so I'm just going to assume. I think that's an important thing that we have to just get more involved in it.
Well, as an example, my son was just recently on a trip and they were sitting at the table and they put all of their phones in the middle for dinner. And I was like, oh, yay, that is such a good
amazing
thing. Totally amazing.
So great.
Yes.
So great.
But what would your recommendation be to empower parents and caregivers to really navigate where their children's mental health is being shaped?
Well, one would be setting your own example. So you put your phone away too. That's really important because it's kind of hypocritical if you tell your kid to and then you don't. Ask them how their day was and don't accept fine as an answer, because good things happened that day and bad things happened that day, and they had feelings throughout the day that they felt, and it's a good thing to talk about it. So just take fine off the table and say that there has to be an actual answer on both. And you do the same thing. You tell them what at work was not great, or what wonderful, or something wonderful that happened, but really make the effort to have the actual conversation and actually talk about things that mean something. Because we can easily say fine and then pick up our phones. You might as well just not ask the question at that point.
Right. So create the space to make those real life interactions. Be intentional. Great. You've been on the front lines of adolescent psychiatry long before it became a headline, but you made a huge pivot and you went from treating patients one-on-one, running the Psych-ER, to building a company that could reach people by the millions. And every transformative journey starts with a moment of vulnerability and really a huge leap of faith. Tell me more about that. What was your personal why that propelled you to make this shift?
That's exactly what I say. A leap of faith was exactly how Robert and I talk about it. Robert is my co-founder, Robert Crane, and he does not have a medical background. So he tells his story about why he decided to make the pivot. He was in finance before, and I met him through a mutual friend who's a psychiatrist. When he and I talked about this, he told me his background. He had his own traumatic incident that had happened, and he couldn't find a psychiatrist. Was basically why he decided to pivot and start this company. And at that point, he was going to pair up with a clinical leader. It ended up being me. And, when he and I talked about it, what his idea was, at that point, I was about 15 years into my career, maybe. And I thought to myself, well, what I'm doing right now in the ER, outpatient work, whatever, I could do that for the rest of my life. That's fine. I'm a doctor, and it's a worthy job. Somebody's got to do it, and I enjoy it. I really do enjoy it. But I also thought this is an opportunity to make a real change, and not just a change for patients, but I think it's also a real change for doctors, because there wasn't something like this for doctors to be able to work in this way. And I thought, if I actually wanted to make a change in medicine, in how psychiatry is practiced, this is a vehicle where I can actually make that happen. So I had my little leap of faith as well. Robert and I got together in 2019, and we just happened to open in April of 2020, which is, it's stupid timing. There's no other way to put it. It's just stupid timing.
Yeah. Really like a total message from the universe, though, right? Like, so needed.
I'm the type to believe in cosmic messages, and 100% message from the universe. Yeah, April 22nd, Earth Day actually, is going to be our 5th birthday or 5th anniversary. I don't know how to say it, but yeah, it'll be 5 years in April.
Amazing. That is amazing. Well, so you shifted really from the comfort of what you had known and expanded that into really the unpredictable world of business, but giving you an opportunity to move from being able to service like your community and thousands of people to like millions. I mean, what was that emotional landscape for you? How did you manage that transition?
It was wild. I still remember. So we had offices. We were going to be hybrid. I'm actually in my office where I would have seen patients. And we quickly realized in March that in New York City, of all places, right in the epicenter, we shut down. And then we thought, yeah, it could be a couple of weeks. We'll be back in office in a couple of weeks. Everyone kind of thought that. And then very quickly, we realized that wasn't going to happen. We were hoarding toilet paper and like watching Tiger King. Remember that phase of the pandemic? So it wasn't going to end. And we were actually getting calls from people to schedule appointments from all over the country. But we're based in New York. But we thought, well, people will come to the office. So, you're calling from Arizona or you're calling from Rochester, New York or something. You're not going to be able to come to the office when this whole thing is over. So, we can't really accommodate you. And then we realized, well, this isn't ending. And telehealth, which existed well before the pandemic, is going to be a major part of our lives moving forward. So that's when we decided, okay, we're going to have to start expanding and we're going to have to get clinicians licensed in other states to make sure that when telehealth regulations, if they change and you have to have a license in a state, that there's no interruption in care. So we started doing all that. And then we had to expand our operations. We had to expand all those other parts of a business that are necessary in order to grow.
It wasn't part of your plan initially?
Not this quickly. Not this quickly. We always wanted to expand and we always thought we would be hybrid. We thought we'll start in this office and we'll start building and then we'll go from there. But since we had to pivot very quickly, we said, well, I guess this is happening sooner than we thought. And so we pivoted to expanding to different states. And right now I think we're in 45. We can do business in all 50, but we're active in about 45 right now. So yeah, super exciting.
Congratulations.
Thank you.
Most definitely. I mean, obviously that time was so strange, but to have to like accelerate the pace of that growth and respond to a demand, a need, and that need's not going away by any means. What did you have to unlearn from clinical training to step into being a founder?
You learn a lot in med school. You don't learn how to run business. Let me tell you that much. You certainly don't learn how to run a business. And it's the only job I really had is doctor. You say you're going to be a doctor when you're 6 and then you just end up one 30 years later. It's odd. But a lot of doctors, if you ask them, they've never really had another job. It's such an interesting thing. I feel very confident about medicine. Obviously, this is what I do. So you're not going to ask me something about medicine that is going to make me stress me out or anything. I'm like, yeah, I can answer questions about medicine. I'm good. But what I had to learn was the business side of it, like learn what a chief operating officer does. Like I knew there was one at the hospital. I didn't really know what they did, but it never really mattered to me because I got my job done. They don't teach you this on career day. Right? These are all the things that you need to learn, go into a functioning business. And it's been incredibly educational, incredibly humbling. Medical school is hard, but I could not do what a lot of these people do. I mean, you mentioned your friend is a data scientist. I'm fascinated every day with the data scientists that we have here, the work that they do, the analyses that they do. I mean, I've dissected a human being and I'm impressed by somebody that can use some of the software. It's just fascinating to me.
Whatever lands for everyone is a curious journey for sure. How has that unlearning and like I'm piecing together, what is the COO doing? What do I need operationally and systematically and from an organization perspective? How does that shape the culture for you?
It's doing all of that and balancing the fact that we are a medical practice and we provide healthcare and, our doctors see patients. Like the core of our business is very simple. It's doctor seeing patient. And I always use the word patient and I'm very specific about that. And I know some people use client. I'm very specific about it because it is a therapeutic relationship. I'm a doctor, you're a patient, and our relationship is therapeutic. It's not financial. When I'm in the room with a patient, it's because I want to do something to help you feel better. Leave the rest of it to us. And that's what we tell our doctors. We're handling the operations. We're handling the financial. If you do good quality work, everything else flows from that. And that's how we built this business. We built this business at its core to be quality clinical work. And then everything we do is shaped by that. It's not so much I had to unlearn, but I had to learn a lot, including how to go to investors and how to go on the board and how to talk about how those clinical values have to continue to be supported and clinical quality has to continue to be supportive as we grow a business. Because if you don't focus on the clinical quality, then everything else is going to fall apart. If you're not producing a good product, everything else falls apart. And that's, that translates into any business. I mean, honestly, you have to have a good product at its core.
Most definitely. I've talked to so many people about that, and it's got to be inclusive, and it's got to really serve the population. But it's part of your guys' mission to serve underserved populations. So it's one thing to have a vision, but it is another thing to operationalize it and scale it to 45 states. And Psychiatry isn't just a healthcare company. It's really an infrastructure play that's rethinking what access looks like. Scaling virtual care. I read you have achieved over 1.7 million visits.
Yeah, we're going to hit 2 million very soon. So in the next couple of months, we'll hit 2 million. Yeah.
So what role has technology played to support this grand vision? And more so, how do you maintain a high standard of care?
We're a telehealth company. Technology is integral. Like, we couldn't actually do what we do without functioning technology. We have an amazing chief technology officer. She started with us. It was the end of last year, but it feels like she's been here forever. We had great people before her as well, not to diminish them, but she's been absolutely wonderful since joining us as well. And it's not as simple as just calling your doctor FaceTime, but there's so many considerations about privacy, about security, all these things that go into, you don't have to think about when someone's coming to your office, but when you're doing it over a televisit, it is important. And little things I didn't think would be an issue. Like, there's a little green light that comes up as we talk on my computer, right? And I'm sure on yours as well. There's something, there's some paranoid patients that think we're recording them. So those things that come up, you just have to figure out, how am I going to navigate this when a patient asks about it?
And it could be triggering for them.
100%, 100%. So there's the provider part and making sure that they have, the tools, the resources that they need in order to be able to actually practice what we're doing. And then there's just what we're building and have built, will build in order to make everything from when they land on our webpage through to when they're seeing their doctor, all those other parts, the intake process. We also have a very robust referral process where if you go to your primary care doctor, they can send us a referral and you can enter our system that way as well. So that workflow, how do we navigate those partnerships in that workflow? When we want to send somebody to a higher level of care or a different level of care, if they need, let's say, an intensive outpatient program, how do we make sure that we can refer them out? And all those things, technology can play such a role to enable it and make it easier for a patient. We've come a long way, but there's still such a stigma. There's still such a roadblock to people seeking mental health care that you put even the slightest thing in their way, some people will just use any excuse to say, you know what, I'm not going to do it.
Take this exit.
Exactly. You mentioned earlier it was a sign. Some people will take it as a sign. Look at this. You know what? The website's down. Obviously, the universe does not want me to see a psychiatrist. It sounds silly, but it's true. And that's why we want to make it as seamless as possible. Because if you've taken that first leap of faith to seek care, we want to make sure that we make it easy for you to actually get the right care with the right person, so that then you will come back and continue and do what you need to do in order to feel better.
Psychiatry's platform is really designed for scale, but it keeps empathy top of mind. How do you really balance that efficiency with intimacy in that virtual care experience and creating that comfort? From my understanding, and even in my own personal experience, having a one-on-one conversation with someone like this, there's so much more opportunity for connection, because oftentimes in an office, not so much in psychiatric care, but therapy, you're in there for much longer than you are typically with a doctor. How do you balance that use of technology, efficiency, quality of care, and really the continuum of care for patients?
I get asked that question by other doctors too. They said, well, it's better to see somebody in person, is it? And I said, you know what? It's different, but it's not necessarily better. When somebody's in person in your office, okay, as a psychiatrist, one of the things psychiatrists will look at is, well, how are you dressed? Have you showered today? That's a really important thing to look at. Are your nails done? Typically, your nails are done, or you haven't been doing that, or do you have makeup on? Those kinds of things are important. Did you put on weight? All those, or did you lose weight? All those things the doctor can see when they come in, just from looking at you. When you have these visits, oftentimes the person is home, the patient is home, and then you get to see, well, how are they living? What does their home look like? Is it a mess? Do they live in squalor? Is it neat as a pin? You can meet their cat. That sounds ridiculous, but it's actually so important. It's so important. I've had so many people to lift up a you get this intimate look into their life that's different from the one that you get when they're in the office. If somebody starts crying on the screen, I can't hand them a tissue. I can do that in person. But it's a very different kind of intimacy that can be formed, and it's still very important. The relationship with a therapist, a psychiatrist, a physician in general, or any sort of medical provider, is a very intimate one. Not obviously not a romantic one, but a very intimate one. Obviously, you're talking about the most important thing, right? Your health, letting them into something that you probably wouldn't tell anyone else. So it being in your home creates something that is incredibly special. And it also gives a lot of trust. It takes a lot of trust to do that. A lot of our doctors are home too.
Right. They're peering into their homes as well.
Exactly. So we tell docs, anything that's on screen is fair game. And we learned that when I was in school. We didn't have telepsych, but they said, well, if you're wearing a wedding ring and a patient asks you if you're married, you're wearing a ring. If you're not wearing one and they ask you if you're not married, it's all grist from the mill. And the other important part that telehealth is really good at in child psychiatry is it's much easier to talk to parents because they tend to be around. And it's just an easier thing to coordinate when they're at home. So even though it's virtual, it doesn't mean that you're less empathic or that the relationship is qualitatively different. You can develop a really strong relationship either way.
Great insights.
Struggling to find the right psychiatrist? With Talkiatry, getting high-quality mental health care is finally simple and in-network. Talkiatry matches you with a licensed psychiatrist who gets it and meets you where you are, online, on your schedule. No waitlists, no chaos, just real care that fits your life. Visit Talkiatry, that's TALKIATRY.com to get started today.
Are there any upcoming innovations or tools that Psychiatry will be applying that you're excited about adding to the stack?
Well, we're always tweaking and refining our intake process. We want to make sure that there's this balance between making it too specific, because we really want you to be matched with somebody that will be the right match for you and that you'll stick with. That will be your doctor moving forward. We don't want you to do an intake and then say, you know what, it's not the right doctor for me, and then have to switch. And we want to make sure that whoever you meet is the one that's good long term. But there's a balance between doing that, because we've all done those surveys where after a while you're like, I'm done with this.
Checking the boxes just to get it done.
Exactly. So there's that balance. So we're always refining that process to make sure that the right doc and the right patient can be matched. There's a little upfront. Every healthcare conference I've been to, whether it's like a technology healthcare or a clinical one, the letters AI just are everywhere. It's just all consuming, and everyone's like, well, what are you going to do with AI? What are you going to do with AI? And I was like, well, there's a lot one can do with AI. Let's be totally honest. So every technological thing that we do, we have to make sure that it makes life better for the doctor and for the patient. So it's not a matter of how am I going to incorporate AI? I have to make sure that any way that I incorporate it, it makes things better. So we're doing a lot of testing on how we can use different products in different ways that will help both the doctor and the patient. If you talk to anyone in pretty much any industry right now, they will say that they're just trying to figure out how AI is going to fit into things.
Well, and it's not going anywhere. You just definitely have to figure out how to apply it effectively with compliance and meeting regulatory needs. And then, is it a benefit, or is it just something new and sexy and time consuming? And it's nice you've got a great CTO on the team to also help make these decisions.
Yeah. No, she's wonderful. Yeah.
How do you balance the operational challenges of growing an organization while really staying true to the core mission of patient-centered care?
We have on our clinical team, there's obviously I'm the chief medical officer. I have directors, national directors, and then we have local or regional leaders as well that then manage cohorts of docs. And those regional clinical leaders, they're all psychiatrists. All the clinical leaders are psychiatrists. And we also have some therapists. So we do have a psychologist and therapists that are clinical leads as well, regional leads. We have operational partners that work with all those clinical leads. So for all these cohorts of clinicians that report up to these chief psychiatrists or therapy leads, we have an operational leader that works very, very closely with them. When you're a doc here at Talkiatry, and I'm going to say doctor, we do have some nurse practitioners, we do have therapists, but when you're a doc here, you're a doctor, but you're also an employee. So there's the clinical stuff, and that's why you talk to your clinical leader, and if you have clinical questions or management of a patient or something like that. But if you need to talk about your time off, if you need to talk about your schedule, that's where the operational leader is really, that's their expertise. That's what they do. in awe of our operational team. If you want data on how many patients you've seen, how to increase the number of patients you're seeing, how to decrease the number of patients you're seeing, all that's where the operational lead is truly invaluable. So the chief with that operational leader together really makes the experience just seamless for our clinical staff.
Most definitely. Just finding that balance with the holistic service, one, of what you're offering and meeting patient needs, but two, your practitioners' needs and those providing that service, and then having that collective team behind it to make that happen, which behind every system and successful business is a team. And you've built a massive one with over 500 clinicians on board and support staff and operationals, 500 clinicians.
We have about 500 physicians, about 40 or so nurse practitioners, and almost about 175 therapists, almost 200 therapists.
And then the operations team.
And then the corporate team, which is several hundred people as well.
Okay. Well, how do you create a unified culture that keeps everyone aligned with Psychiatry's mission?
The clinical team, it's easy because they all signed up to be mental health care professionals. So that's an easy sell. When you are an operational leader, when you are in technology, when you are in all of these fields, in all of these functions, you can function anywhere. Our chief operating officer was at Uber before he came to us. So when people come to work at Talkiatry, it's because they're genuinely interested in our mission, in mental health care. So the leap of faith, right? They're coming here because they want to work in mental health care and it's important to them. Whenever I meet somebody that's looking to join our team, that's a non-clinical person, I don't know what it is, but they will tell me all about whoever in their family has ever had a mental health problem. And I sometimes tell Robert, I was like, oh, they told me that their, brother has autism or their sister has anxiety. He's like, they never tell me that. I was like, no, they're going to tell me that.
Because you're the doctor.
Yeah. And they want me to know, and they want the team to know that this is more than just a job. They actually are in a place where they can be a little picky, and they pick this specifically because if you can code anything. But they're working here because our mission actually means something to them. And that's always great because it's a lot easier to explain to them why, no, we can't make this change because it's going to be a HIPAA violation. They'll get it's like, oh, that's right. This is healthcare and that's important.
Yes. Well, and that's like self-selecting. I mean, even Robert, as the issue he had experienced himself, and he was seeking a solution for it. And so a lot of people, we self-identify with what's so important to us.
Yeah, absolutely. Absolutely.
Are you a woman leader, CEO, or hiring executive looking to build a powerhouse team? At EDM Talent, we specialize in connecting top-tier talent with companies that are redefining the future. Whether you're scaling a startup, diversifying your leadership team, or searching for mission-driven professionals who align with your vision, we've got you covered. With a people-first approach, we help you hire exceptional talent who not only meet the job description, but elevate your organization. Let's build something incredible together. EDM Talent, where great companies meet great people. Let's talk. Visit edmtalent.com today.
With your providers, how do you protect their well-being while asking them to deliver such high-quality care to people in crisis?
Put your oxygen mask on first. It's that entire concept. So it's incredibly important to us. And again, that's something very early on. I explained why somebody can't actually have 100% productivity. You can't actually spend 100% of your working hours face-to-face with a patient. Because occasionally you'll need to use the bathroom or maybe make a phone call, and just finding that balance of, well, how do we incorporate administrative time? And what is that, how does that look financially? And what is that going to mean? Like, all those things are super important. We look at it as, how do we do that and keep a really high quality standard? So for example, our visits with a doctor are an hour intake, half an hour follow-up. So when somebody asks me during the interview process, how many patients am I going to see? It's like, well, that's actually a hard question because it depends on how many hours you work. But let's say you work an 8-hour day, figure, lunch and maybe an hour administrative time. And then depending on whether you have follow-ups or not, it could be anywhere from 12 to 15 patients. I'm like, oh, that's it? Because there's so many other places where they'll double and triple book and have 15-minute visits and just make it a conveyor belt. But the way that we built things, we really focused on quality being at the center. And we've built our model around that so we can give people more time with their patients. And that's really important. Few people have said, oh, I've spent too much time with my doctor. I want to spend less time, especially now with their psychiatrist. So that's one part. And a second thing is, we ask them. We get feedback. Everything that we do, we're obviously not the same company we were 5 years ago, but all the changes that we've made are based on feedback from our docs. So when you not only tell people that they're going to be involved in the processes, but actually involve them in the processes. We mentioned AI. We're going to do pilots with our docs. Our marketing, for example, like ads don't go out without us having looked at them. I'm selling my doctors. Of course, they're going to know what ads we're putting out there. All those things we've involved our doctors in. We have a wellness committee. We actually have a formal wellness committee where we evaluate burnout. We do it systematically. We look at those things. Our burnout are significantly lower than what's been advertised as Medscape does a survey, Doximity does surveys, and it's below the average, which is good. And then, they're W-2 employees. So they have paid time off. They have a 401k. They have a good salary. They have healthcare. We have really attractive healthcare packages for our docs. Those are all really important things. Like, adults don't need these things, but they have a job. So we give them really good benefits in that way.
Our basic needs all need
Our
to be
basic
met.
needs.
Yes,
Yeah.
most definitely.
Yeah.
But about the team, trust is an essential key to any partnership. Tell me more about your partnership with Robert, your co-founder.
We started coming to the office in the pandemic. Like, he and I spent all day together. And even obviously since before that, when we met, he said this when we first really met. He's like, I want us to be really close. I want us to really trust each other. He's one of the people that if I have my phone on silent, he's one of the people that can actually ring through, kind of thing. Yeah, it's my best friend, my brother, and him. I know his wife. I know his dogs. These are, really important aspects. And we spend a lot of time together. And part of it was the pandemic, just seeing only each other. We sit 5 feet away from each other all day. So this is my private office, but we have a shared space upstairs and literally sit 5 feet away from each other all day. So it's an incredible amount of trust. And I meet this guy in 2019. My friend says he's interested in doing this. Why don't you meet with him? He's successful. He has a great job, makes lots of money, beautiful wife. Why in heaven's name would you leave a successful career like that to take a chance on starting a company that nothing might come out of it? I mean, I'll always be a doctor. So I hang a shingle and move on to the next thing if worse comes to worse. Why would you do that? You get a little like, who's this finance bro that wants to do that? He is the opposite of that. He is the opposite of that. So when I heard his story and it was so genuine, I was like, he's actually really taking that leap of faith you mentioned. He's really like putting it all out there to do this. And it was so genuine. And you could just see how important this felt for him. At the time, I remember talking to my mom at the time, and she's like, who is this guy? Why would he want to do this? And I was like, you know what? I believe it. I believe what he's saying. It's an incredible amount of trust. And it's really funny that we finish each other's sentences now about things, and we have the same taste in foods. We know what each one's going to order now when we go out to dinner. It's actually pretty funny. We really are like family.
What was a moment that really tested the two of you and your leadership? And then how has it shaped your approach or your ability to influence or lead and build your teams?
If you were going to look in our timeline, if you're going to put the nodes on that timeline, our latest one, which came just about a year ago at this point, that was led by Andreessen Horowitz. And when we were raising for that, which was the year before that, I was taking care of an elderly parent. And we were in the middle of a raise, a really crucial one. I was back and forth to Europe caring for my mom who passed away later that year. And I was doing everything by Zoom, and I was coming back. I don't know how I made this trip back and forth so many times, but he was so understanding about how I had to balance that. And I was incredibly grateful that I was able to do that. I thank him immensely for that because that was incredibly special to be able to be with her. That really solidified. He gets it. He gets how important this is to me, and he gets that Talkiatry is also just as important to me, just in a different way. So being able to have him understand that. And then honestly, like, go to these meetings, and being the only doctor in the room, usually you can ask me all the medical questions you want. That's fine. But really getting that crash course in, how the finances are. And if we get questions, he's a superstar. He knows, he's brilliant. How we balance that, that yin and yang of the medicine needs the money, learning from each other and trusting each other in that way. That's probably it.
Well, the cosmos was meant to bring you guys together for sure. What advice would you give to other leaders who are striving to balance that trust and accountability within their own business partnerships?
Being open and honest is really important. The comparable thing in a relationship is don't go to bed angry kind of thing. But we got to talk about things. I mean, there are things we don't agree on. We will eventually come to something. There's a point where neither one of us is happy, which I think is probably when we come to the right option. I think everyone has to be a little disappointed in when negotiating something. So that's the most important thing. You can't hide anything. You really can't. If something's not working, you got to say something. This is my baby. This is his baby. It's very important to us. And we both in the end, our goal is the same, right? We want to continue to grow. We want to continue to have a successful business. We want to provide excellent healthcare to people. Those are shared goals. There's no question. How we get there, sometimes we think differently about how that path is going to go. But in the end, we have the same goal. So we can negotiate that path as long as we're open and honest about it.
With compassion and grace with each other.
Screw up, he screws up.
We're human.
That
Yeah,
happens.
it does.
Yeah.
The billable piece, that's incredible. I'm sure your providers are feeling like such a weight lifted, and an hour with a patient and then a half hour of follow-up. That seems like unheard of. It's like 10 minutes in, gotta go, next one. And really that value-based care, it's the term, I actually had Syntex Health on fairly recently, and they're doing like contracts around value-based care. But your guys' mission is really all about making care accessible and personal and impactful. And you're leveraging innovative technology in value-based care to really address cultural nuances. And that's like very transformative in the mental health space, especially for underserved communities. And so tell me a bit more about value-based care isn't just cost savings. It's certainly about outcomes. So how do you redefine success for both patients and providers?
For providers, if you ask them what success is, it's not making a lot of money. It's about getting patients better. You want your patients to get better. In psychiatry, it's really interesting. Value-based care has been kind of hard because how do you measure it? You know, psychiatric care in and of itself is not terribly expensive when you think about it. There are not a lot of procedures. It's a doctor's visit, so obviously there's a cost of whatever it is to see the doctor. The medications aren't, you know, most of them aren't actually not that expensive. SSRIs are actually not that expensive. So those kinds of things aren't actually very expensive for anyone. And of course, that's relative. I don't want to minimize that people struggle with healthcare costs. I'm talking in the grand scheme of medical care. What is expensive, though,
it's not
is
like a quadruple bypass surgery. Yeah, gotcha.
Exactly. But what is expensive is the person that doesn't receive psychiatric care and what that means for them. Because when you look at what causes disability and what causes mortality and morbidity, think about it. Cardiovascular disease, number one with a bullet. Smoking, drinking, stress, obesity, not taking care of yourself and exercising. Those things sound familiar? How many people with mental health issues do all those things? Using drugs, all those things that we see as actually causing very serious medical problems could be tied to psychiatric care, because you see that patients that don't receive psychiatric care have worse outcomes, and they're on the medical side. So when we talk about value-based care, it's really hard to measure it on the psychiatric side because in the end, they're not terribly expensive. What you have to look at is, well, what does it mean for the medical side? So that's where we're saying it's important to look at the patient holistically. Psychiatry is not different from medicine. Every doctor you know did a psychiatric rotation in medical school. My medical debt is just like anyone else's from graduating medical school. For some reason, we compartmentalize it as something different, when in reality, it's all tied together. I still teach a little bit in medical schools and medical students and residents. And what I tell them is, psych patients have babies. They have heart attacks. They need surgery. They break things. So you're going to see a psych patient at some point in your life, and you have to know enough about psychiatry to know how those two things are tied together. So that's where we're really looking. One of our payers, they had their own analysis on our outcomes. So what they did is they did a cohort match with patients that are seen at Talkiatry, and they matched them with other patients on use their insurance. The only difference was that obviously our patients were seen by a Talkiatry provider. They had a non-Talkiatry provider see their patients. And what they saw was that overall, our patients had much lower hospitalization and ER rates, all cause, not psychiatric, all cause hospitalization and ER rates. And they saved a significant amount of money. It was close to $700 per member per month when the patients were seen at Psychiatry. So that's the kind of work that we do to say, well, are we actually doing good work for our patients? So we have this study that was done by one of our insurance partners, and then we do our own work. Our quality department is also our research department. We do our own research here as well.
What do you think you can attribute that to, the improved outcomes?
We have really, really good clinicians here. It comes down to that. Some of these doctors are very smart. I hired my former chair and her husband. They both work for us here. Yeah, she's been a lecturer at Harvard for years. She's an incredibly accomplished, successful physician, and she works here now. So we just have really, really good clinicians that work here. I'm going to toot my own horn a little bit. We hire great people.
I think you have to. And I think it also says a lot because what you provide in return, leadership starts from the top down. And so people want to stay there. What you're creating, what you've created, they want to run through walls for you and they want to solve their patients' problems. So when you see, I mean, solve, that's a big, maybe spanning the ocean, but that's their intention. That's what they want to do.
Yeah, all the doctors that come here have the same goal, and that's to be good doctors, to provide good care. That's their goal. And we just want to give them the space to be able to do that and not have to think about all the other stuff. Just be a good doctor. And if you allow them to be good doctors, they'll be good doctors.
That's right. Cultural identity and systemic bias. That's really quite a challenge in healthcare. How do you ensure that your approach with psychiatry is sensitive and inclusive to the needs of diverse communities?
We have an incredibly diverse workforce. So it starts with having a diverse workforce. It's incredibly important. Everyone can be a good doctor, but not everyone can be the right doctor for you. Being able to work with a doctor that you feel comfortable with, that will have an understanding of your culture, your background, is important. It is different. I'm a child of immigrants and I speak another language. So if somebody wanted to speak a language that I speak, it's important to be able to do that. Or just little things, just knowing that a holiday is coming up, or if you're not married by a certain age, why that's important. Those little things that you would normally have to explain to somebody, it's nice to know that somebody already understands that right off the bat. So that's one of them. One of the things is that we strive to have an incredibly diverse workforce as well. Super important, both for our therapists and our psychiatrists. There's so many communities in the United States, rural communities, lower income communities, where the statistic is about 60% of counties don't have access to a psychiatrist. So I think telehealth is so important. So just the modality in and of itself is bringing access to people that normally wouldn't.
Most definitely. And with like marginalized populations, what's a barrier to entry to serving those populations? And how do you guys work on addressing that?
There's different things. There's the financial. We're enrolled with so many different insurance companies and with Medicare that we try to make it just like any other doctor that you'd go see. So, pull up your insurance company and you'll find us, which is really, really great. I'm not making it a luxury item. It's incredibly important. It's also the stigma. There's still such a stigma, and it's cultural, it's gender, socioeconomic status. You name a characteristic of a human being and you can probably find where that stigma will come from. So there are very few people that just grew up just it being natural and being okay to see a psychiatrist or mental illness. Just talked about it. It's changing more and more. But for the most part, there's something in your background that is taught you need a psychiatrist.
And it's much easier to take that exit ramp. That's right there. Yeah.
Yeah. I mean, going back to adolescence, boys shouldn't be sad. That's something that's still happening. I feel bad for boys, especially because it's this push about you need to be more sensitive, but at the same time, you have to be a man.
No, and they're struggling with this crisis of their own identity and like created a lot of equity for ourselves, which is amazing. But we haven't brought men along or boys to men as through that transition period to also allow them, and I'm generalizing for sure, and I'm not research scientist or have enough knowledge on this, but speaking from opinion and from observation, they're suffering from not having responsibilities or even different transition experiences in their life that give them that value.
Yeah. And they're going to look for something somewhere to fill that hole. And that's what we have to remember. You create a vacuum, and what is the nature of a vacuum? So if you create that and give them mixed messages and then don't allow them the space to ask the question, well, what do I do instead? Or what do I do now? Or how do I navigate this? Or what does being a man mean? They're going to figure it out. Somebody's going to fill that hole. Somebody's going to tell them something and you're not always going to like it. So we have to really keep that in mind. And that's just one example is with boys. You can think about that example. You pick a characteristic and we can think about an example that would apply in a similar way.
Most definitely. Most definitely. And there's a lot we can control, and still there's a lot that is out of our control, out of our purview. How do you think the future of care will shift if more companies prioritize outcomes versus billable hours or encounters?
Some people think that being a therapist or psychiatrist is easy. It's really not. And it's not something you can just do. That's why before you asked me why we have good outcomes, because we have really good doctors. Once you start prioritizing outcomes, it's a reckoning on how you run your business, who you're hiring, and what you're expecting them to do. Now, there's only so much you can do if you don't have a doctor on board. There's only so much you can do if you're completely focused on text-based treatment or something like that. There's enough mental health work to go around. Don't get me wrong. We're never going to have enough coverage for all the different things that are needed in mental health care. We also have to acknowledge that there are limitations to certain modalities. We're limited as well in certain things that we can do. Listen, we're fully telehealth. I can't give somebody a long-acting injectable medication. I can't see patients that would need that. People with schizophrenia would probably need to get a long-acting injectable. It's really standard of care. So I can't treat that. And I know that limitation and I'm good with it. That's what we're living with. So if you're going to focus on outcomes, then you have to really think about your limitations. So if you're going to have good outcomes, it's a reckoning for you to say, what is it then that I can do? And once you ask that question and honestly answer it, that's when you can decide where it is that you're going to fit into this world of mental health care.
From your founder journey, I mean, you're really rewriting what psychiatric care can look like and creating that access and bridging the gaps. We can't solve everything, like you just alluded to. And it's time and place, and it's the right practitioner at the right time, but allowing and creating that continuum of care for people and referring them as appropriately as you should. Your business in 10 years, what impact do you hope that Talkiatry will have had on our society and on the mental health landscape?
You create something like, what will our legacy be? What is it that I want to do next? When Robert and I started Psychiatry, we were very specific about what we wanted to do, which was high quality outpatient-based care, which is essentially what we do. And then it was expand that across the country and provide really excellent care. The thing about psychiatry is if you meet a doctor, you're at a dinner party, what do you do? I'm a physician. What kind of doctor are you? Immediate next question. In psychiatry, you ask that same question. You're a psychiatrist. What kind of psychiatrist are you? I happen to be a child psychiatrist. I focus on addiction. That was my specialty. So my favorite patients were teenagers who use drugs. My favorite patients. That's what I liked working with, which for some other people, it's anathema. They wouldn't know what to do. Then psychiatry, we were really focused on this one particular part of it, but there's so many different parts of it. And as I look at Talkiatry down the line, this is where we started, and we really want this to be the best at what we're doing. But there's so many other parts of psychiatry where we can say, well, what will be the next thing to tackle? Is it something like higher acuity patients, for example? Like one of the research studies that we published was about, we looked at outcomes for our patients, just straight outcomes. How do they do after a certain period of time? So we had this published a couple of years back, and we saw that our patients, on average, their PHQ-8 and GAD-7 scores were at a level of the moderate to severe range, which really in some cases be referred to like an IOP or an intensive outpatient program. But we were seeing them here. If you had asked me before we actually did the study, I would have said that our patients were in the mild to moderate range, but they weren't. They were actually moderate to severe. And at the end of the study, what we found is their improvement over 15 weeks or 5 visits was actually similar to them having been in an IOP. So fantastic outcome. It was wonderful. So to me, that says, you know what? I thought we had milder cases. Well, actually, they're more severe. So in the beginning, that's what we thought. So then I thought, well, then actually they're moderate to severe. What we're really talking about is lower risk patients. So severity and risk don't exactly line up in psychiatry. So then I'm thinking, well, maybe we'll be able to take higher risk patients if we had a different modality, like an IOP or a PHP, where you can have more background care. So those are the kinds of things. Specialty care. Already we provide care to children. We focus on pregnant people. So we do have specialties in perinatal and postpartum care. So those kinds of things we'd like to also look to expand, like how we provide more specialized care to people. We have geriatric care right now, geriatric psychiatrists. But then if you tell me in the future, that's what I would like to do clinically.
Well, and it's pretty powerful that, I mean, you, in essence, answered that for yourself. You thought you were dealing with a moderate level patient. Really, you were dealing with a much more extreme patient that needed more support. But also, your services were creating better outcomes for them. So, like, it's planting seeds and it's creating that opportunity, but also being open to it.
Yeah, for sure. When I saw that, I actually had to double and triple check. I was like, are you sure? Can you run these numbers again? It was wonderful to see. Yeah.
Well, and then I loved earlier you mentioned having a great team of providers, but that full circle feedback loop where what are they seeing and what is a critical need that is maybe not being addressed and how can that become an opportunity for you to help more people.
Yeah. And, in the end, again, that's what we want to do. The core of our business is helping people and providing excellent care. Yeah.
What have they learned about being part of this journey with you? What's left an impact for you hearing from them?
Every time a patient says thank you, I feel like I want to burst out crying. It's a simple thing. It's awesome to think that you helped somebody. Honestly, that's all really a patient has to do, is say thank you. And that's plenty for me. And I see the same about our docs. So many of them allows me to spend more time with my family, or I had retired. I didn't think that I wanted to practice medicine anymore, but I came back to it, or I really needed to move to take care of a loved one. And this allowed me to be able to continue to practice even though I moved. Being able to help their lives because of their job. People ask me, like, what advice do you have for people going into medicine? I tell them, think about the life you want to lead, and then that's how you pick your job. And I would say that to anyone, not just people in medicine, but you think about the life you want to lead, and then you pick your job, because you're going to resent your job if you don't. And life's too short. No one's on their deathbed wishing they'd spent more time at work. Very few people would say that. So the fact that we're able to provide a career for people that feels good, that they feel like they're doing really good work, that they're using all the skills that they learned, and it better fits into the way that they want to live their life, that's incredibly special to me. So I absolutely love that. One of the things that Robert and I do is we travel a lot. We go to conferences, we do speaking engagements, all these other things. And our assistant coordinates we have the same assistant, it's very convenient, coordinates with our clinical engagement team. So if we're in a city, she arranges to have brunch or dinner with the doctors that live in the area. So we just got back from Dallas, where we had brunch with some of our clinicians in Dallas, and we just sit with them and have brunch and talk about how things are going and what's good and what's not and what's going on in your lives. Two of them had just had babies, talking about their kids. We want to really connect with the docs, and we want to really show that we appreciate them and we want to hear from them. And that's not lip service. We genuinely want to connect with our docs and not just be faceless people that are the founders. Our email address, the same as everyone else's. Here I am. You can reach out. It's not coded by the NSA here, folks. So you can reach out to me. And we want people to realize, no, we really are accessible, and we want to hear from you. So that's really important to us as well.
That's fabulous. I mean, my morning routine is a meditation with a breathing practice and then gratitude. And gratitude can be really hard to find when you're in crises. So yes, hearing that thank you from patients, I mean, that has to just feel, especially considering where some people start and where you take them, and how that journey has impacted their ability to show up in the world and find that gratitude. I mean, that has to be really special for your providers.
It really is. It really, really is. And yeah, one patient, which is incredibly sweet of her, she sent the office a box of cupcakes. It was incredibly sweet of her. It's completely unnecessary. And it was a result of me actually referring her out because she needed a higher level of care. She sent us cupcakes. It was so sweet of her. I'm not going to encourage anyone to send anyone cupcakes. It didn't need to happen. But it just shows that she needed to hear it and feel supported and say that it's not a bad thing. You need a different level of care, but this is what, in my expert opinion, I think you need.
What would you hope that the next generation of mental health innovators asks themselves before they jump in and build something like Talkiatry?
Well, first is, why are you doing it? Make sure that you're coming into it right from the right place. Motivation is a really big thing. Healthcare is not easy, and you're dealing with people that are vulnerable. Going to a doctor is hard. No one wants to go to a doctor. I shouldn't say that. There's some people that do, but normally, in most cases, going to a doctor is a scary thing. And that's why people avoid it a lot. That's why people don't get their mammograms or don't get their prostate checked, or they don't get their blood work done, because they're scared of what's going to happen if they do. And so they're vulnerable when they're coming to you. So if you're going to go into healthcare, understand that and have the right motivation, and know that whatever you decide to do, whatever intervention, whatever business you decide to create, just make sure you're doing something for the benefit of the patient. You can build a successful business if you keep that in mind. And one thing I told Robert right in the beginning, I was like, I need to be able to look in the mirror. I need to be able to tell my mom what my job is. I need to be able to be proud when I go to a conference, or if I see my friends from med school, to tell them what I do. If you're going to start something, make sure that whatever you're doing in healthcare is providing good care to people that are scared and vulnerable. You have to keep that in mind. It's the most important thing, because everything else you can figure out. The business models, you can figure it out. The financials, all of that you can figure out. But if you don't have that, then you're doing a disservice.
Most definitely has to come from that heart center, from the right place, not just about making money.
Yeah, there are easier ways to make money than be a doctor. Let me tell you, way easier ways.
Sometimes an entrepreneur. I mean, geez.
Yeah. I mean, like I said, Robert was doing just fine before he started the company. But he genuinely wanted to do something good. So here we are.
Yes. Our last guest left a question for you. What is an uncomfortable truth about your industry that more people need to hear? And what are you guys doing to change that?
The last couple of years, been a lot of bad press about, especially around mental health care, Jesus, and telehealth. There's been a lot of not so great players out there. And part of it was not keeping that patient in mind. The bad things you hear about in healthcare are maybe the loudest things, but they're not the most common things. So there are plenty of good doctors, good NPs, good nurses, good therapists, good psychologists that care incredibly. Those good clinicians far outnumber the horrors that you might hear about. You're not going to hear about good care. You're going to hear about the bad care. You're much more likely to leave a bad review when you hate a restaurant than to leave a good review if you love one. And that's the same thing with doctors. You're much more likely to hear about all the bad things than the good things. So just know that even though those are the things you hear about the most, the vast majority of it is actually incredibly good. Doctors care incredibly deeply. Everyone in healthcare, they care incredibly deeply. This is not an easy job. I can't stress that enough. There's an incredible amount of burnout among doctors. The suicide rate of doctors is actually incredibly high. It's much higher than the general population. And you have to know that people go into this because they really genuinely want to help. People should hear and I hope believe.
Thank you for sharing that. And I think even just our conversation today, I mean, you have expressed that so wholeheartedly. The way you talk about your providers and about your business partner and about your team members. I mean, it is everything you've shared has been so genuine and authentic. I'm super excited to continue watching the evolution of psychiatry and how you're just making such a huge impact on people's well-beings. I know you're proud of what you've already accomplished. Is there anything that you'd like to leave our guests with today?
Don't consider mental health care different from any other part of your care. I would argue that it's probably the most important part because it is the roadblock sometimes to getting other things done. So if you feel like you need to talk to somebody, talk to them. And it could just be to find out that there's nothing you need. Just check in. I want to encourage people to just not think of mental health care separately from the rest of their care. And even if you don't want to do it, if you don't think it's for you, please don't judge other people that want to do it or need to do it. The fact that they're actually reaching out was very, very difficult for them. So a lot of grace for people that choose to do it, allowing them to do it and respecting them and really encouraging them is really important too.
And that action, that effort of being supportive around that, it really helps to remove the stigma around mental health care. Beautiful conversation today. Thank you so much. I appreciate you being here.
Oh, it's so great to be here. Absolutely, Brenda. Thank you so much for having me.
Thank you, Georgia. It's a pleasure. Most definitely. Georgia reminded us today that mental health care isn't something separate from the rest of our well-being. It's often the key to unlocking it. Whether you're a founder, a parent, a leader, or someone just trying to hold it all together, you don't have to do it alone. Visit Talkiatry.com to get started. That is TALKIATRY.com. If you're experiencing crisis right now, if you or someone you love is struggling, support is available immediately. You can call or text the 988 Suicide and Crisis Lifeline anytime. It's 24 hours a day, 7 days a week, confidential and free. At RedefineHER, we believe in redefining care, in taking the next small, brave step, and in building a world where asking for help is seen as a strength. So thank you for tuning in to RedefineHER. Keep leading with heart, keep showing up, and we'll see you next time. Thank you. If you enjoyed this conversation, don't forget to subscribe here or anywhere you listen to your favorite podcast. And be sure to share, like, and leave a review. Together, let's continue to redefine what's possible in women's health and wellness. Until next time, stay inspired, stay empowered, and keep redefining her. This episode of Redefine Her is produced by Taryn Long and Brenda Armstrong and proudly sponsored by Idiom Talent Partners, experts in search and placement services for health tech and femtech companies focused on building dynamic, inclusive teams. Learn more at idiomtalent.com.